Hi, I'm Dr. Andrew Chappell, and today I'm going to talk to you about respiratory tract infections. So, my PhD is in gut microbiologist, so I've done quite a bit of microbiology in my life, and it's a fascinating area, and I'm very interested in the immune system and how it interacts with microbes, and I'm also very interested in nutrition as well. So there's lots of ideas around the world of nutrition about how we can potentially prevent or even cure microbial infections of the respiratory tract. And I'm going to talk a little bit about that in this session alongside what are the common infections that people get and how they occur and how you can potentially manage these things. On this slide here is some plants in the corner. They're echinacea plants. That's a very common herbal remedy that people from the world of nutrition utilize. So you can buy echinacea capsules. I don't use it personally myself, but I know people are very, very keen on using it. Oh, let me just change this. Looks like the GPS has been turned off. Okay, so getting back to this. Of course, the best way to solve a problem is not to have one in the first place. So good personal hygiene is one of the ways in which you can prevent yourself getting a cold, cough, flu, whatever it actually is. So hence the hand sanitizer. And then once you've got one, you can reduce the transmission by using your snotty tissues and your hand sanitizers and things like this. We've got Benylin cold and flu capsules on here, and then you've got your strepsils as well at the same time. So these are common ways in which I certainly, when I encounter a cold or flu or whatever, try to manage these things. And really with this, it's often about managing the symptoms rather than actually trying to cure anything, because very often it's a matter of time rather than it actually being any sort of panacea for the virus. Anyway, let's get on with this. So what I'm going to talk about in this session is basic anatomy of the upper and lower respiratory tract. Describe common infections. I'm going to talk about how they occur, and then I'll talk about some rationale around nutritional interventions and why people think they may or may not work. So here you go. This is it. This is your your upper respiratory tract and your lower respiratory tract. So it's separated into two areas. You've got the upper respiratory tract, which is your nasal cavity, your nasopharynx and your oropharynx. After that, you've got then your trachea, and then you've got your lungs. That is the lower respiratory tract. Now, when we talk about upper respiratory tract, very often we're also including the sinuses. So that is the vessel that goes between the eyes and the nasal cavity along to the ears. And then we're also talking about the ear as well. So you'll have departments in hospitals and people that will specialize in ear, neck, nose, and throat. So that's a specialist department. So that all falls under the upper respiratory tract. As well as the upper respiratory tract, with those potential organs, you've got your adenoids, and then a lot you might be familiar with your tonsils. So very common thing that people get when they're younger, and they can get when they're older as well, is tonsillitis. And your tonsils, these are lymph nodes, essentially, large collections of where you'll have white blood cells or immune cells in there. And when you get some sort of throat infection, they can swell up and you can have difficulties in breathing. Now, if you've watched my other lectures on microbes, you'll know that we have got commensal microbes or symbiotic microbes. And these are microbes, and they don't necessarily just belong to the bacterial group. They could be fungi as well, or archaea. And these are microbes that live in and around your body and on your body. And in health, you can see your throat, mouth, nose, your lower gastrointestinal, upper respiratory tract and lower respiratory tract, sorry, getting confused here, is populated by microbes. So you've got things like Streptococcus, you've got Haemophilus, you've got rhinovirus as well, Staphylococcus, Prevotella, and they all live in your respiratory tract. They're always there, and they're always serving important functions as well. And I'll come on to talking about them in a little bit. However, some of them act as opportunistic pathogens as well. So when the balance gets out of whack between the agent, or the microbe, if you like, and the host, and there's a gap in the defenses, that provides an opportunity for some of these microbes to go from having a commensal relationship like Streptococcus and outgrowing and outcompeting the other microbes which live in that area, and that results in the illness being onset from there. So you can see Haemophilus, you can see Streptococcus, again, both in the health state, but also in the respiratory tract infection state as well. You can also see that in the lungs, for example, there's low biomass. So there's a low amount of microbes in there when you're healthy, but when you're unhealthy, you get an increase in microbes, and you get a reduction in diversity of microbes as well, in favor of microbes which can outcompete and occupy the niche. So that's what's going on there. So you don't have a micro-free environment. There's always microbes there. Now, I mentioned that these microbes play an important role, okay? These microbes prime your immune system. So within your nasal cavity, within the lining of your lungs, etc., your cells are all lined up here in tight junctions. And between them, they've got proteins which bind them all together and keep them very, very close. And they stop the microbes infiltrating through to the bloodstream from here. So one of the things that microbes do is they cause your body to stimulate and to grow these microbes, but at the same time they also tell the body to secrete mucus. So you'll be familiar with having a cold and all the snot that comes up out your nose. That mucus, microbes cause your body to stimulate mucus production. And without microbes, so if you put someone in a germ-free environment, or if you put an animal in a germ-free environment, they never fully develop an immune system, and they never fully develop properly the respiratory tract, those tight junctions, or the mucus, because there's not a need for it. So they are stimulating the production of these defensins, which create tight barriers, these proteins, this mucus at the same time, and the proper development of the immune system, which lines your respiratory tract. So that's what they're doing. Now, your respiratory tract is covered in these tiny little hairs, often referred to as cilia cells, which have got these vibrissae on it, yeah? That's those tiny little hairs. And what they do is they act like a big sieve, okay? And they filter out any dust and any pollen which might be getting breathed in through your noses. And some of us have got more hair in our noses and our ears and things like that than the rest of us. But if you look at this image on here, you can see what looks like little eggs with hairs. In fact, it looks like a little bit like a coral reef. That is an electron scanning microscope image of cilia from the larynx, so down the back of your throat. So what that does is that captures dust, it captures pollen. Because microbes are on top of the dust and the pollen, it captures them at the same time, and it filters them out, right? It filters them out. Within that sort of situation, you've also got mucus being secreted by your goblet cells, and that mucus, not only does it form that physical barrier, but you've also got antimicrobials in that mucus at the same time. So you've got things like alpha defensins. And what that does is that basically works like cyanide on microbes, which might end up sticky and stuck within your sea lion and within your mucus, and it kills them off essentially. The other thing you've got going on, and more apparent on the other slide, is you've got immune cells which are reaching out, sampling the environment. They're sitting and they're detecting what's going on and telling your body to upregulate mucus or to send more white blood cells to an area, maybe from the tonsils at the same time. You've got enzymes which are there to break down pollen and large protein particles and things like this as well at the same time. Your adenoids, your tonsils, they're big reservoirs, like I say, of white blood cells. So they're going to trap nutrients as they pass by. They're going to trap microbes as they pass by. And then your white blood cells are going to get to work on anything that is potentially going to infiltrate on here. Now, I've got an image here of cigarettes. And one thing we know that cigarettes do is they damage your cilia cells. Okay, so you can see this example I've got here, and they damage mucus production and these little hairs. So someone that smokes a lot will be immunocompromised in terms of just having that barrier function compromised, but also in terms of the immune cells which are in there as well. They're just not going to be able to cope quite as well with infections because their lungs and their respiratory tract immune system is damaged. And it's not uncommon for people as they age to develop things like COPD, for example, because of a lifetime of smoking. So I mentioned this already as we travel down into the lungs. We go from the upper respiratory tract down to the lower respiratory tract. You've got your bronchia, which is your large tube which comes all the way down from your lungs, from the esophagus up here. You've got your bronchus, which is those individual tubes, and then eventually these split into your alveolus sacs. And these are very, very thin sacs which allow for the diffusion passively of O2 and CO2 in the other direction to allow respiration to take place. And they're covered in capillaries. So it's a very nutrient, blood-rich area. But it's also direct contact and interaction with the outside environment as well. So it's an opportunity for your body to interact with the outside world. And because of that, it's also an opportunity for pathogens to infect your bloodstream. So your bronchial are lined with, and these sacs are lined with lots and lots of different types of immune cells. And you can see some of them labeled on here. So you've got macrophages, for example. You've got CD8, CD4. These are different types of T cells. You've got natural killer cells. You've got dendrite cells, which put out fingers like protrusions or dendrites into the environment, and they sample what's going on out there and decide where to secrete more mucus or to upregulate the immune response, or maybe even to tell your body to sneeze to get rid of some of the detritus which might make its way in there. So your whole respiratory tract, not GI tract, is lined with immune cells as well, continuously sampling the environment and acting as a defensive mechanism in time of need, and to make sure that you can adapt to the situation. I mentioned this briefly on the other side as well, but it's not just cigarette smoke, okay? Pollutants in the natural environment. So there's an image here from Dubai where there's a sandstorm right in the bottom corner, and some smog. There's another one here of a city from China. And then again, you've obviously got the cigarette smoke as well. None of this stuff is good for you or your respiratory tract, right? Not so important that you understand all the individual different metrics which are upregulated or downregulated in response to pollutants and to smoking. Just sort of giving you a bit of an idea that constant exposure to this over time is damaging to your health, compromises your immune system, and it makes you more liable to potentially getting an infection or what might lead to potentially a disease over time. So clean air is good for you. Incidentally, vaping's not the best for you as well. So why do infections occur? Well, I've just given you some reasons there. So your environment matters. So if there's pollution, for example, that's not the best. Potentially influences your respiratory tract in a negative way, leaving you susceptible to get infections. But we've also got things like the lived environment. So in the 19th century, slum living in the UK and throughout the Industrial Revolution throughout Europe caused cholera epidemics and TB, tuberculosis epidemics as well. People living in very close proximity to each other, passing on the disease from person to person to person. So that can make a difference as well, just by sneezing, coughing, poor hygiene from here. I've got something here called herd immunity. What the immunity is like in the population matters. So during the age of exploration, when European settlers came over from Europe to the New World, to the Americas, they brought with them the smallpox vaccine, and there was no herd immunity like there was in Europe. So they reckon around about 95% of indigenous people died as a consequence of that. In the opposite direction, the natives passed on the syphilis virus to the Europeans, and they brought that back to Europe. So there was no herd immunity. No one had ever been exposed to these things before. Until you've got herd immunity, there's going to be more and more infections. You've got other things. So you've got the host itself. So again, if you're a smoker, right, you're more at risk. If you've previously had an infection, so if you've had a disease before, or an infection before from one of these things, like chickenpox is a classic example, then you don't necessarily get it the next time round. You've got your immune system primed to it. We've got nutritional status. So how healthy is your diet? Have you got lots of fruits and vegetables in it? The healthier you are, the more likely you are to be functioning optimally. More likely you are to be functioning optimally, the less likely you are to get an infection. And when you get the infection, more likely you are to brush it off much, much quicker, less severe it's likely to be. Traveling, if you do a lot of traveling, airports, trains, buses, commuting, back and forth, touching lots of different surfaces, in contact with lots of different people, coughing, sneezing, etc., more likely to get sick. Sexual behavior. I mean, I've mentioned syphilis, say no more. The actual virus itself, so if you'll remember, we had COVID, and we had lots of different variants of COVID. Some of them were extremely infectious, they had pathogenicity associated with it, but not necessarily particularly virulent, yeah? And over time, the virulence of the virus got less and less and less. So it's still infectious, it just was causing less people to become sick as a consequence. And then I've mentioned as well, the environment. So like the dusty environment, microbes live on dust. Humidity. Malaria copes well in tropic environments, right? Are we using antibiotics and pesticides in the environment as well? That will cut down on your exposure to microbes. But that might not be a good thing either, because as I talked in previous sessions, I discussed the hygiene hypothesis, and maybe we need a little bit of an exposure to some bugs as well. You've got where you live. If you live in a more populous urban environment versus if you live in the countryside, again, you're just interacting with different bugs, depending on how clean the environment is as well. And then you've got your temperature as well. Certain bugs will do better under certain temperature conditions, but your body will also do better under certain temperature conditions as well. If it's really cold and you're shivering a lot, you might be more likely to catch a cold because your immune system's compromised. Okay, I mean, how they spread. I've talked about this a little bit on here. So you've got sneezing and coughing on here as examples. Poor personal hygiene, so not washing your hands and so on from here. The environment particularly dirty, so dust particles and things like that on there. If you get a cut or something on your arms, your wrists, well, anywhere in your body really, that's an opportunity for a potential infection from there. There's a needle here. So, I mean, one of the issues with the HIV/AIDS epidemic was users were sharing needles, so they were getting infections in that particular way. You've got ingestion as well. Things could just get in by you eating them at the same time. And on here, you've got the iceberg of infection. So you can get infected by something and have absolutely no symptoms whatsoever. You may have immunity for it. Maybe it's just a completely transient microbe, which you go on the train that day, it gets in your system, and then it's out your system before you know it. And it just passes you by completely. But some of these things take time to incubate. So you might get an infection and it might be 6-7 days before you develop symptoms. After that, it reaches a threshold at which the immune system really can adapt and know something about it. And then it may be another 4 or 5 days before you get that full-blown immune response. And then it might be out your system within 10 days from there. At the very tip of the iceberg is death. Okay? In most cases, microbes just transient, not doing anything for you. Just pass you by, order commensal. Infective symptoms, that's your next step after that. And again, very, very rare that these things lead to death. But why take the chance, right? Okay, that leads us on to talk about respiratory tract infections. So these stats are from the NHS. Respiratory tract infections account for half GP visits. You can go into your supermarket and just look at the cold and flu section. You can see how many cold and flu tablets, sore throat remedies, nasal anti-decongestants, tissues, headache capsules, there are. You can also go down your supermarket aisles and see how many vitamin and mineral support supplements there are, see how many different herbal teas there are, promising you as ways and means in which you can fight your infections and your cold, right? It's big business. 2025, 873,461 admissions for respiratory disease, not including Scotland. So that's the data for England. Huge amounts. Of them, 56,000 are influenza. So that is the flu. And pneumonia is the other 60-odd thousand, right? After that, you're talking COPD, bronchitis, asthmas. These are all reasons why people might be admitted. All in though, you're looking at 11 billion on the NHS. That's what it's costing them annually. And some of this stuff, I mean, if we think about smoking and lung cancer, we can certainly reduce the burden there if we reduce or we change our lifestyles around vaping and cigarettes and other tobacco smoke. COPD, again, a knock-on effect from the smoking as well. Asthma, again, maybe secondhand smoke and pollutants. Maybe we can do something about that as well. But it's big money we're spending on this, and it's very difficult to control, particularly if we've got a culture as well whereby mask wearing is not the norm. In fact, it was the norm during COVID, but post-COVID, people have moved away from masks. We're not fully, or rather, we're still working from home in a lot of cases, and that's probably cutting down on some infections. But schools, hospitals, universities, workplaces, leisure centres like swimming pools, etc., these are all great places where you can get a cold and flu because people are coughing, sneezing. Think about an airplane, for example, circulating air over and over again. Very, very difficult to manage these sort of things. And there's not vaccines for all these things, apart from flu, diphtheria, whooping cough. We don't have a cure for the common cold. We just don't. And it's complicated as well, as it will come on to in the next slides, you'll see. Not all conditions are caused by just one microbe. It can be a combination of microbes. You get atypical examples. Okay, so let's talk about some infections. So sore throats are very often caused by Streptococcus pyogenes or pyogenesis. You can get something called strep throat, which can develop into scarlet fever if it gets bad enough, and that's whereby you get red rashes all over your body, around your face, around your neck. You develop what's called furry tongue. You can see an example here of a white tongue here, which is kind of furry. That's treated by antibiotics, so erythromycin and penicillin as well. So you need an antibiotic to treat these things, and it's spread by coughing, sneezing, things like this. Yeah, and strep has got lots of different serotypes. Serotypes slightly different from a strain, in that the genetic material is not entirely different. It's more like if you imagine to a human being, just people with different hair colors. And if you imagine those different hair colors could induce slightly different virology to an individual. So slight difference here. There's other ones as well, however, which can contribute as well to strep at the same time from here. If it's not treated, you can get complications. It can be potentially life-threatening, and you can see, I mean, this looks like tonsillitis, right, off of here, but you can get something called Guillain-Barré syndrome, and I've had really bad tonsillitis before. You struggle to swallow, you struggle to breathe, you can't eat anything, you struggle to even take on fluids, and it can feel like you've got knives or glass in your throat, right? So you need antibiotics to really to treat this. If untreated, you can get acute glomerular phlebitis. That is swelling of the ankles and the feet, puffiness. You can get inflammation of the heart and the joints, and that can lead to cardiac arrest. So again, if untreated, this can become life-threatening. Can lead also to Guillain-Barré syndrome as well, whereby the immune system becomes, not the immune system, sorry, the central nervous system becomes infected, and you start to get issues with your peripheral nervous system, like prickly feet, pins and needles, and things like this, which again can damage you long term as well. So it can be complicated, but usually it can be cleared up with antibiotic use. 150 years ago, this would kill you. You might be familiar with this as well. So this is Candidiasis or Candida albicans or yeast. You can have with a yeast infection of the throat. So maybe you get antibiotic use, clears up the strep. However, you end up with a dysbiotic or an imbalance in the microbes which live in the throat, and then as a result of it, fungus is able to outgrow other microbes in there, and they'll produce that white, milky, like pus substance on your throat. Candida, as well as what we also see in thrush, so genital thrush. So effectively, you've got thrush of the mouth from here. So you can get this as a complication. Okay, other conditions. You can get diphtheria. Diphtheria is rare, okay, because we've had vaccinations since the 1940s. And this is caused by Corynebacterium diphtheriae. Get it through sneezing, coughing, sharing items. I recall when I was working with the Glasgow Warriors professional rugby team, every single athlete on that team had their own water bottle. They were not allowed to use each other's water bottles, and we had signs up everywhere saying, do not share water bottles. And it's to prevent infections, because if a player gets sick, he's out of a match. And if one player gets sick, well, you can isolate him and he doesn't play, but there's no reason why the whole team should get sick. You just don't take those sort of risks. So yeah, you can get it from sharing items, so cans of Coca-Cola, bottles, etc. from here. It's symptoms not too dissimilar to strep, but you get swollen glands, sore throat, fever. Instead of the redness in the throat, it's a thick white coating on the throat, in the same way that you get from the thrush as well. But you can also get pus-like blisters, which can be infectious as well at the same time. And again, if untreated, can lead to heart failure. So again, this sort of thing could potentially have killed you pre-1940s, if you like. And again, treatment with antibiotics is what we do. Okay, so moving on. There's lots of different types of infections you can get of the lower respiratory tract. So you've got Haemophilus influenza, or you'd be probably commonly more knowing it as just the common flu. Can affect the lower respiratory tract on here. But there's other conditions that you can get as well. So you can get tracheobronchitis, epiglottitis, sinusitis, pneumonia. You can get all of these things as well at the same time. Yeah. Common symptoms of these things again are like the flu. So you've got coughing, sneezing, sore throat. All of these things in response to your immune system producing white blood cells around the area, hence the swelling of the region. Coughing, producing mucus, which irritates the throat to try and produce more antimicrobials, and sneezing to try and get rid of the potentially damaging microbes as well. Croup, unfortunately, is something that one of my nieces got a few years back as well, and that had to be treated with ampicillin, so antibiotic as well. You see potentially in young children, things like influenza can be life-threatening, yeah, and also in the elderly as well. Hence, there as the flu shot program. I include the athlete on here as well, because there's something called the open window theory, whereby athletes can develop sports-associated asthma, so exercise-associated asthma. You do a lot of asthma, you do a lot of exercise, you develop asthma, and that can leave you open to infections as well. Okay, this is flu. Unfortunately, most of us have experienced flu. If you have an immunocompromised individual, so someone who's got an autoimmune disease like Crohn's or colitis or asthma, if you've got a lung disease, type 2 diabetes, cardiovascular disease, types of cancers, you will be more vulnerable to flu. Much, much more vulnerable to flu. And again, it was the same with COVID. People who had these things were higher risk than people that didn't have these comorbidities. People over the age of 65 and young children under the age of 5 as well, high risk as well, and often are offered flu shots. Now, the peak seasons for the flu are December to March, so winter months. And we usually have a vaccine developed by around about the early autumn time. And the reason we have that is because it's cyclical. So what happens is, in the southern hemisphere, they have winter at a different time of year than us. So colds and flus and things like that go up during the months between March and November, and that gives immunologists time to develop a vaccination program that they can then ship over to the northern hemisphere. So that's kind of how it works, right? Common symptoms you get associated with flu. So you can get muscular symptoms. So you get extreme tiredness, sore joints. I mean, exhausting. You get coughing. Sometimes you get vomiting. You'll be familiar with all the nasal pharynx symptoms, the runny nose, the aches, the pains, high fevers. And the fever's an interesting one because bacterium like to incubate and viruses like to incubate around about 37 degrees, your body temperature. However, your body raises the temperature to try and offset the efficiency of a virus to fight the infection. That's what's going on there. Things can get complicated though. So someone with flu can then go on to develop pneumonia as well. And that can affect one lung or it can affect both lungs, okay? So if it's both lungs, it's obviously worse than if it just infects the one lung. I've included on here again, just that the hand washing, that was advice during COVID and it's still good advice now. We get transmission again from poor personal hygiene, coughing, sneezing, things like that, touching surfaces, sharing things. So best way to solve a problem again is not to have the problem in the first place. So if we can prevent, then that is obviously going to benefit us in the long run. Okay, so we've got other conditions as well. So you've got bronchitis. So this can be caused by a number of different opportunistic pathogens. So you've got Haemophilus influenza, Haemophilus parainfluenza, you've got pneumococcus, and you've got Mycoplasma pneumoniae as well. These all cause infections. You can see we've got cocci, shaped bacteria. That's those circular ones up there. I wouldn't be surprised if that's pneumococcus up there as well, causing bronchitis. And again, unsurprisingly, if you've got asthma, if you are a chronic smoker, then things like this can become life-threatening. And in a normal situation, you've got your normal bronchial tubes here, which allow for the transportation of oxygen and the carbon dioxide out of the lungs. In bronchitis, you get the swelling of the muscular lining of the bronchial tubes, but you also get at the same time the development of pus in here as well, and phlegm starting to be produced as well. So you may be coughing some of that up, which doesn't sound the best, does it? But that can literally clog up your lungs and be life-threatening. Really, really can, until you get a close in your airways. You see fever, musical notes. I'm sure a lot of people have experienced that as well, whereby you make noises when you're breathing on here. And again, it's treated by antibiotics, in this case, tetracycline. Okay, I mentioned influenza and now I'll mention pneumonia. There's different types of pneumonia. And again, this is a significant cause of death. Often what can happen is someone goes into a hospital with an infection and then they might acquire a secondary infection when they're in the hospital, and it could be something like pneumonia is the thing that gets them in the end, or they go in for a surgery and they end up catching pneumonia. So it's amongst very young children and the elderly and frail. This is where you've got potential risk of death on here. It can happen very quickly. People get fevers, coughs. They get pleural pain, which is the gap between the lungs and the thoracic cavity, which is lined by a fluid called the pleura, and that can start to ache. So when you're literally breathing, you've got it all the time. You also get this dry, unproductive cough as well. There's different types of pneumonia. You've got lobar, which can affect an entire lung. And you can see an X-ray scanning image here of Streptococcus pneumonia in the what would be the right lung. And you can see it's just affecting the one lung. However, it can affect both lungs. And then you can get bronchopneumonia as well, which, as the name suggests, starts to affect the bronchi. So it's not necessarily the lung per se tissue which is affected, it's the airways of the lungs as well. And then you get atypical pneumonia, which can be caused by multiple different strains. It's not necessarily down to Streptococcus pneumonia. And the difficulty with some of this stuff, as I mentioned right at the start, is that one antibiotic might work on one of these bacterium, but not necessarily all of them. So it might take a combination of different antibiotics. And symptoms produced by one bacterium might not be the same as another one. Very often chest x-rays are used to sort of help diagnose what's going on with people and to diagnose pneumonia. There's a few other types as well. You've got Legionella pneumonia, so people might be familiar with the term Legionella disease. I used to work in a leisure centre, and we used to always have checks for Legionella. Someone would come and test the pool water to make sure that you weren't getting Legionella. And if you were to go and work for Scottish Water, for example, you're constantly going around reservoirs and treatment areas checking to see what concentrations are of Legionella, because water vapor can cause potential issues as well. Again, in terms of treatment, antibiotics, identification of an agent, what you can do is you can test someone's blood, you can test their sputum, so saliva, and what you would do with that is you can grow it on a plate in a lab, test which microbes are growing, because you use these things called selective agar, which only certain microbes can grow on, and that will allow you to identify which particular type of microbe is growing, and then potentially how to treat it and what antibiotic to use. There's serology as well, so you can see if certain endotoxins are elevated within the bloodstream as a consequence, and you might choose your combination of antibiotics based on that as well. Okay, so getting to the end of this talk now, and I want to talk a little bit about potential herbal remedies and nutrition, because as a nutritionist, I don't think you can talk about respiratory tract infections, and certainly as a sports nutritionist, without talking a little bit about nutrition. So again, I mentioned right at the start, go around the supermarket aisles, you can find lots of things like this. Here's a herbal cold care. So this is supposed to, I don't know, stop you getting sick or not as sick from here. But you've got other things like zinc defense lozenges. Whenever the team that I worked with, the Glasgow Warriors, were going on tour, or traveling somewhere, we gave them travel packs and it had things like zinc lozenges and vitamin C and things like that. Now, we got most of this stuff for free from companies like HealthSpan, but we were better off just giving it to them just in case, to try and offset any illnesses as well. The other two I've got down here, that's vitamin D. That's the other one. So vitamin C, vitamin D, and zinc, these are common ways in which people try to combat potential infections and disease. Now, vitamin C is probably the most famous one, and it's because of this guy called Linus Pauling. Linus Pauling's a Nobel Prize winning scientist, a chemist, I think he was. And he suggested that megadosing with vitamin C back in the 1950s was an effective way to prevent you getting the common cold. So just take lots and lots of vitamin C, thousands of milligrams, not the amount that you get from just eating oranges. And this was the proposed mechanism, essentially, which was microbes produce reactive oxidative species. So oxidative stress, that causes inflammation. Vitamin C is an antioxidant. So if we've got enough vitamin C in our body, then that will quench some of those reactive oxygen species produced by the microbes and thus prevent us from getting vitamin C. That's your rationale. There are other mechanisms proposed as well, though. So your immune cells, neutrophils, what they do is they fire these things called oxidative bursts, effectively reactive oxygen species at microbes, and that damages microbes and allows your body to eradicate them from there. So you produce a high oxidative stress load from your immune system, and you've got vitamin C in your body as a way of managing and mopping up some of that excess vitamin C. So you need a certain amount, otherwise you might become immunocompromised as well. And again, that's the rationale. That's the rationale. So you can read this paper on here about it if you want. There might be a inflammation angle, there might be a oxidative stress angle on this. Certainly vitamin C prevents us getting scurvy, but that's a way. And people have since suggested that it interacts directly with inflammation pathways and things like this as well. Zinc's another one, and in combination with vitamin C, zinc has been proposed to influence the immune system. So again, there's a few different mechanisms here whereby you need zinc to help you produce these tight barriers between the cells so that that stops microbes passing between them, like I described right at the start of this lecture. You need your zinc to help you with several enzyme reactions as well. And it allows the development of T cells and B cells, which are white blood cells, from progenitor cells like stem cells. So if you've not got enough zinc, you can't develop your white blood cells as well. However, zinc is involved in thousands of enzymatic reactions. So if you don't have enough zinc, then you see a compromised organism just in general. It's not specific fully just to the immune system, but certainly it's important, zinc. It is important. And sports nutritionists have caught on enough that it's important to suggest that we should all be having zinc lozenges. Vitamin D. Vitamin D, in a sufficient term, when you've got enough vitamin D, allows the proper activation of the innate immune system. So it allows your antigen presenting cells, that's what an APC is, to go out and to interact with microbes which are potentially harmful, and then your body's own white blood cells. If you don't have your enough vitamin D, you don't potentially have that mechanism in place, which leaves you liable to inflammation and to infection, right? And again, here's a nice schema on it. At the bottom of this presentation, these are links as well that you can follow up on. However, the question is like, does any of this stuff actually work? One thing's true, and I mentioned this before, like nutritional status matters. If you are a healthy organism and you've got enough vitamin C and you've got enough vitamin D and calcium and zinc and things like that in your body, then your body's systems are going to work more effectively compared to if your fuel tank's empty. So the recommendations for vitamin C in America are different from the vitamin C recommendations in the UK. The vitamin C recommendations in America are based on the amount you need to saturate a white blood cell so that you get optimal function. In the UK, it's how much do you need to offset scurvy, right? So certainly, if you've got topped up levels, you're probably going to do better. Probably going to do better. The other thing that I've got on here is, this is the inflammasome. This is the signaling pathway for inflammation, and there's various receptors on the outside of the cells that will interact with the outside environment. And then within the cell, there's lots of different proteins which signal each other, which eventually tell your body to upregulate some sort of inflammatory process, and then the cell does something, right? Now, there's thousands of these little pathways. Just because we can take a petri dish of immune cells and we can dose it in vitamin C or zinc or vitamin D, and we see some of these different pathways being upregulated, doesn't mean that you're going to see any real world effect on cold and flu symptoms. Okay, you see some things getting upregulated, right, great. But mechanistic reasoning doesn't necessarily always translate into any real magnitude of effect, right? A 1 or 2% increase in something called NF-kappa B, which is a inflammatory marker, doesn't necessarily translate into 1 less sick day a week. It doesn't necessarily work like that. Sometimes better things to actually track are hard markers rather than soft markers. So things like, for example, what has been the cold and flu tablet drug purchasing for a supermarket for this flu season? What are hospital admissions? What are numbers of sick days, for example? These are better markers to look at sometimes than some of this other stuff. And when it comes to vitamin C, that seems to be the story. And it seems to be the story with a lot of this stuff, that it doesn't look like vitamin C per se necessarily reduces you getting sick. If you get an infection, you get the infection, you get the infection. What it might do is it might reduce the overall duration. So instead of being sick for 7 days, you're sick for 6 days. And it might reduce the severity. So instead of being bedbound, you can get up and walk around a little bit, right? But these things are difficult to measure because they're all subjective. They're all subjective. It is, how did you feel? Did you call in for work, etc.? And some people will get a cold or flu or whatever and just get on with their lives and not phone into work, whereas someone else might get a little snivel and then they're off work for 5-6 days. So everybody's different with this stuff, and it makes it very difficult to determine how effective some of these things are. But it isn't clear if supplementation or at all is really all that effective. And it's why there's no approved health claims with vitamin C, and our current Cochrane database consensus is that more research is really needed to work this out. But at the moment, we're more firmly of the opinion that probably at this moment in time, it doesn't really do a whole lot. And EFSA, the European Food Safety Authority, they're the ones that set out approved health claims. They're the ones that will say things like whole grains are good for your heart, and that they will reduce blood pressure, which will reduce cardiovascular disease. There's nothing like that for all your herbal teas and things like this. Not in Europe anyway. You can make different claims in the Americas. Okay, that takes me to the end of this presentation. So just to summarize, respiratory tract infections, they can be upper or lower, but they include the neck, ears, throat, sinuses, and lungs, right? They might be the result of opportunistic pathogens. There might be things that are already living in there, and they just happen to gain an advantage over the host, or they could be something coming from the outside environment, and you're a little bit immunocompromised, and that's how they manage to get a niche. They're a major health issue and economic burden. Okay, some can lead to death or permanent damage, and those with comorbidities are certainly most at risk, including the young and the old. Your immune system, it's set up to prevent you from getting infections, and that's by creating physical barriers, chemical barriers, biological defenses, and social barriers as well. So herd immunity, think about that as well. And nutritionally, I mean, the better our diets are, more rich in fruits and vegetables and vitamins and minerals, the better, because at the end of the day, this might reduce your duration and severity of the illness, although it's not clear that it actually stops you getting an infection in the end. If you want to read more about this, then certainly check out this book, Infection, Microbial and Biology and Management. That's where I got a lot of this information on this topic. And I hope you enjoyed the presentation and you found it useful. Thank you for your time.